And then, and the reason why snoring is so linked with Alzheimer's disease and heart attacks is because of those episodes. Even if you're not diagnosed with sleep apnea, you could have 8-second deprivation of oxygen instead of 9 to be diagnosed so many times. You do that, you might not come out of a full awake state, but your body awakes and you're shooting cortisol all night. So all day, you're go, go, go with the stresses of life and maintaining a household and work-life balance and everything. And then at nighttime, when you should be repairing, you're just shooting up cortisol.
Welcome to Vitality Made Simple. The following production is for educational and entertainment purposes only. If you need medical advice, call your doctor. Now, let's go to Vitality Made Simple.
Welcome to Vitality Made Simple. This is the podcast that equips you to feel better, look better, and to enjoy better relationships. We're going to hit all three of those today with our guest, Tiffany Ludwicki. Welcome, Tiffany.
Hi, thank you so much, Debbie, for having me.
You're welcome. And if any of you listeners have ever wondered about the implications of snoring, well, you're going to learn today. Talk about relationships, and it's not just about, keeping your husband or wife or whatever awake. It's about much more than that. Right, Tiffany?
Absolutely. Sleep doesn't only impact the partner whose sleep is affected, but it actually affects the person's sleep, even if they don't even realize that they're snoring and they don't even feel unrested the next day. So it affects us mentally, physically, emotionally, in many, many ways.
All spheres. Well, tell us about you and how you got interested in this area. Your educational background fascinated me. Share all that with our listeners.
Okay, I would love to, and I will try to keep it condensed because it was a very interesting journey that I had, which led me into realizing that snoring was actually a problem. My background is in dental hygiene, and years ago, I worked in a gum disease specialist clinic, so a periodontal office. I was people's last resort to improving their oral health, and sometimes I just wasn't enough. And so I started questioning them, and I took a health coaching program to see maybe if I could connect the oral systemic link, which you're 100% familiar with. And from there, I actually healed a little bit of my own insecurities and issues that I was having. And I started speaking to my clients about it and started, advocating for them. I did come up against some resistance because it's one thing for a dentist to connect with a doctor, but even where I was working, they were just like, they don't want to hear from a dental hygienist. Like, no, you're not doing this. It's not in your scope of practice. And so from there, I decided to open my own independent hygiene clinic. And I wanted to be able to grow the awareness and improve the standard of care in my area. And from then, I also started seeing the signs of sleep apnea. Because that's a pandemic of our current life right now, the amount of people that have snoring or sleep apnea. And from there, I was referring people, and they were coming back to me. At multiple occasions, people had said, I've literally saved their life because I was referring out. And then a couple years go by, I end up getting pregnant, and my baby's just not sleeping properly. And we start noticing, like, wow, she breathes really loud. She's snoring. And then we witness sleep apnea events. I was like, okay, everything we know about snoring and sleep apnea. She's not a 50-year-old overweight man. She's not intoxicated. She's not, I'm trying to think of some of the other stereotypical things that we see. But yeah, she's not overweight. Like there's something else going on here. And rather than just referring out for sleep studies, I started to look at what I can do to maybe prevent the snoring into sleep apnea so that way I could save my child. And I looked into myofunctional therapy. I happen to be a hygienist. You need to be a hygienist or a speech-language pathologist. So I was already there ready to go and to learn. And so I learned that, and during my training, my snoring disappeared. My husband used to wear swimmer's earplugs, specialized earplugs because of the snoring. And again, I didn't know it was that big of a deal.
Well,
And
and you're a small person. You're not the typical, like you said, 50-year-old overweight man with a neck circumference that's way too big. So it can be anybody. And I appreciate that you're talking about children because, they don't know how they're supposed to feel. So Tiffany, I want to clarify one thing. When I
okay,
speak to dental groups, I always say that nobody's just a dental hygienist. Never let those words come out of your mouth. You are the dental hygiene chair is the most important seat in the house in the dental clinic because you really hold the keys to life and death. Not only you've taken this extra step of airway, but also in terms of the oral microbiome and oral systemic link. I have such high respect for dental hygienists everywhere. It is huge. And so I thank you for following that path and then gathering more education to talk about airway. So you started a business called Mind Body Mouth, and so tell us what people should look for in their own sleep patterns to detect problems.
sure, absolutely. And thank you. Yes, we all play a vital role in health, and hygienists are placed in a very unique position. So I do agree with the ability in the microbiome. And that's a whole other topic just on oral health. But some of the things that people might not realize that they're experiencing could be things like anxiety, irritability. You could be grinding your teeth. So a dentist or a hygienist would pick up on the wear on your teeth. You could have those bony growths in your mouth that when you get your x-rays taken, it kind of hurts to bite down on. You could have dry mouth, cavities and gum disease, despite having good oral hygiene practices and a nice healthy diet. You could have digestive distress, like unexplainable IBS symptoms, constant colds, flus, and then the things that are really starting to show up as you age and you experience snoring longer would be high blood pressure, poor memory, right? Because those things are coming as a response to not having the proper oxygenation to our brain and to the cells in our body. So those, I think, are the many, many different aspects that snoring could be contributing to, or it could be the root cause of.
Well, and changing the landscape of the oral microbiome is so big. We're learning every day. I interviewed Nathan Bryan. We talked about nitric oxide. And so in your work, you're helping to improve nitric oxide, a key molecule in heart health, brain health, blood vessel health. So that is really bigger than we know. I think every day, Tiffany, more research is coming out in this area that highlights the importance of not snoring because we've ignored it. We've sort of made fun of it, right?
Yeah, it's a funny thing, especially with children. We think it's funny. We think it's cute. It is a red flag, right? But we just didn't know that. We didn't know that at the time. So we can't feel bad about the way we treated it because the information wasn't there. But as you mentioned, it's coming out. The amount of information on nitric oxide and how it's produced in the mouth and the nose and how they work together, and snoring affects both. It reduces your ability to create it too. And on top of that, like, people actually do have shame and embarrassment around snoring. So not only are people laughing at it, but the person who snores is legitimately feeling like bad about it, embarrassed and shamed for doing it, especially when they don't think there's anything that they could do to change it. And the relationship begins to suffer because the spouse is not getting the sleep. And then there's groups out there for just people that are the partner of a snorer. And it's bad.
Well, and I can remember being like at a camp, and in a big, or on a mission trip where we're all in a big bunkhouse on, 20 women in a room. And there's always one or two that you're like, put a pillow over her head. It's just nobody can sleep because of this person. So that just so gets in the way of relationships, because when that person finds out, they don't want to go do those, fun things that they would do ordinarily, because like you said, they're shamed because they're snoring. So what do you recommend someone do? I mean, you hear it, there's CPAP machines. Here in Oklahoma, I want to tell our readers, you're in Newfoundland, Canada, and we're Central Time. You're Newfoundland time. You're 2.5 hours away from us, right?
Yes, Newfoundland has its own time zone where we're at half an hour beyond anywhere like the most eastern point in Canada.
Yeah, that's so interesting. So somebody, there's all these options. Tell about the options and the different benefits and side effects of these different options. Some options only treat the symptoms, correct?
Correct. Yes, you are 100% correct on treating a symptom. And I like to treat the root cause, but not everybody is ready to go there. Most of the time, I am helping people that have tried everything and they still are not happy with the results. Even if their snoring improved, they're still not happy with how they feel. So, which makes a difference, right? Because then you don't really have the feedback to say, wow, this is worth it to even continue on the Band-Aid solution, because they're uncomfortable sometimes. So most people are familiar with nasal strips. Mm-hmm. So the nasal strips can just pull along the cartilage, opening up your airways, allowing you to get better oxygen through your nose, and therefore reduce your snoring. And that's great if your snoring is a result of inflammation or blockages in the nose. A lot of our snoring comes from down here, though, below the nose. So if you're someone who uses nasal strips and you're not getting the results, well, then it has nothing to do with the nose. It has to do with somewhere below the nose, behind the tongue or in the airway. So there's the one thing. And it can sometimes actually, if you reduce your snoring and you're using nasal strips, it can actually hide your sleep apnea, because the sound is restricted, but the apnea event still occurs. So they can be dangerous, let's say. Another option is oral appliances, which you've probably seen, and they can help a lot of people as long as you're doing the right one. So there's oral appliances that help protect the teeth. And a lot of times people who are snoring are grinding their teeth, and just putting a protective barrier on the teeth is not improving the root cause. You're protecting the teeth, but you could increase your mouth breathing. As you mentioned, that affects your oral health in many ways. And it could actually block your airway a little bit more. If you're someone who's had a night guard and you tend to be middle of the night, you throw it out, you wake up and it's not in your mouth anymore. It's because unconsciously your brain is like, this is affecting my breathing. I either wear this or I suffocate. And your brain's not going to let you suffocate if it can stop that. So you end up ditching that night guard. Now, there are oral appliances that actually literally pull your jaw forward, opening up the airway. And so that is great if you're somebody who doesn't need to wake up to kids in the middle of the night and you're not really affected by the need to move your mouth around regularly. Or if you can close your lips over it, it's not going to affect your oral health. And if you just don't mind the mouth being bound pretty much kind of closed and in a position, you don't have that freedom to move. So you can, again, it can work for some people. It's not necessarily compatible for everybody. And their surgery. People literally get chunks of their airway removed, the little hangy ball, the uvula, the tonsils. That's part of our immune system. We're just taking it out. You're opening it up. But if you don't affect the root cause, well, the issues could persist over time. And so those, I think, are the main things that people will relate to. Sleeping pills, too, just to sleep better. I know in 2016, doctors were recommended that should be the very last resort. And it should be for temporary use, maybe around jet lag, traveling, brief periods of traumatic experiences where you just need to really improve your sleep. But people end up like reliant on those. They end up on them for years and years on end. And that really, really affects our brain health over time. And
Tiffany, that shows the desperation of people. When they find something that helps, they'll just keep doing that, whether it's really a good thing in the long run or not. I mean, sleep is so basic.
Yeah. Speaking of sleep being so basic, what I focus on, and I can talk about that, is my last option for sleep apnea. I'll get into it in a moment. But breathing and sleeping, they're more important than food and water. Like we go mere minutes without oxygen, we die. The longest study around sleep deprivation was 11 days, and they had to cut it short because it would not have turned out as a good study. So 11 days without sleep. You can go weeks to months without food and water. And yet the importance put on breathing and sleep within the medical care field are some of the last resorts. It could go back to ancient healing methodologies, right? Yogic, breathing, relaxation, meditation. It's all focused on breath. Breath is life.
As I learn more about the importance of sleep, Tiffany, and how many people are not getting good sleep, I'm reminded of this patient years ago who was going to have brain surgery. And it was a guy who was just super intelligent, and he decided to research neurosurgeons and to find the one that he wanted to do his surgery, because his surgery was so risky. So he looked for somebody who did not take sleeping pills. He just knew how to figure all this out. He looked for someone who was happy in his marriage and, probably not staying up all night fighting. He looked for someone who was not a heavy drinker. He looked for someone who was not in debt, so that they would not be doing, surgeries just for money. It was fascinating. But I remember just our conversation, his name was Ed. I remember our conversation around sleep. He's like, I don't want somebody cutting my head open who has been taking a bunch of sleeping pills and, is dulled potentially from those sleeping pills. Obviously you get a hangover from sleeping pills, just like alcohol.
Yeah. Like that's so, I don't know if intuitive or intelligent, I don't know what the right word is for that, but amazing to connect all of those factors to how they will perform in their life, especially something that's so important. And I've worked in a casino years ago, and there was a surgeon that was there a lot. And I'm telling you, I would not be going to him, because I knew that background. Like, it's just not stable, or it's not healthy. And you don't know. And when you're sleep deprived, it like I said in the beginning, it affects your mental, emotional, and physical health, but it increases your risk of drowsy driving and killing people. So when you're not really there and focused, because you're not getting the deep quality sleep, your brain is not detoxifying. It's just becoming more and more cluttered, like brain fog. And yeah, that can affect your, your capability, but your
judgment. I think it would affect every single part of cognition, because they've shown that people who are sleep deprived react the same as people who are intoxicated.
Yeah.
So, it does impact judgment in every way. It probably makes people a lot more anxious. People who are sleep deprived tend to have more depression, probably more, well, for sure. I've seen studies, more chronic inflammation. What you're doing really does touch every single part of health span. And that's what we really talk a lot about on Vitality Made Simple is increasing health span. So when you see these problems, what treatment or treatments, Tiffany, have you found to be effective?
Yeah. So that's a great question, because it really gets down to the root cause. Because I find the treatment that has lifelong benefits is myofunctional therapy, which you are familiar with. I have heard it on some of your previous podcasts. And what it is It's a modality that tones the muscles of the face and the airway. So you're opening up the airway space. It trains the tongue to function in a very coordinated manner and gives it the strength and endurance to hold the jaw in place despite the moments when we fall asleep and all of our muscles relax. That's usually when we have those sleep apnea events, right? When our muscles relax and everything kind of falls and our airway gets blocked. But if you have the endurance of the tongue and the strength to create this light little pressure in the roof of your mouth, it keeps the airway open. And obviously nasal breathing is the first part of that because we have to be able to breathe through our nose if we're going to close our mouth, right? I heard a phrase that said you should eat through your nose as much as you breathe through your mouth. So thought that was funny. Yeah. Eat through your nose as much as you breathe through your mouth.
Yes.
It does. Yeah.
Yes.
Right? You shouldn't eat through your nose.
You should breathe through your nose as much as you eat through your mouth. Is that what?
Yes. Yeah. Okay. I think I said, the inverse.
But no, that makes sense. We would never think of eating through our nose, but people do mouth breathe constantly. Oh my goodness. That's a good one. Okay, folks, you should breathe through your nose as much as you eat through your mouth. Yep. That's the key.
Other way around.
You should breathe through your nose as much as you eat through your mouth. In other words, you only breathe through your nose. You don't eat through your nose. Yeah.
Yeah. Yeah, exactly.
Mm-hmm.
And so myofunctional therapy, it works on the functionality and ability to nasal breathe. It builds strength and endurance of your lips to maintain that lip seal. Because even if your mouth was kind of open a little bit, you could breathe through your nose, but it could be the oxygen could be seeping out before it can reach the lungs to the capacity that we need. And then the tongue to the roof of the mouth for normal rest posture. And then there's also the swallow aspect. The swallow aspect is an additional part of it. It works on coordination, which is important. But when it comes to snoring and sleep apnea, it's in a program, but it's not necessarily as needed, let's say, for training the proper positions in order to be able to reduce your snoring.
So for our listeners, Tiff, what exercises could they do like right now to strengthen, say, their, the muscle around their mouth, the orbicularis oris? Are there lip pops? Are there, what things would you recommend? If you told our listeners, okay, start doing these 3 things, they're going to make your life better, what would you tell them?
Okay. So if they can already breathe through their nose comfortably, in and out, that's the main thing. So let's just say that they can do that. Then for lip seals, anything that can, like if you clench, let's say, and everything is tight, then anything to kind of stretch the lips, it takes pressure off of the other muscles. So you can be filling up your lip area with air.
Is this it?
Right? So, and the other cheek. So for anybody listening, you're pushing air into your upper lip. And you hold that. And then you move the air to a cheek. And then you move it to the lower lip. And then you move it to the other cheek.
That is great.
Yeah. So you're taking pressure off the muscles that we generally tend to clench on. That gives us jaw pain. It stretches out, but it also, you have to force that lip seal. So it's reducing pressure on certain joints, it's stretching, and it's creating tightness in the lip seal. So that is one exercise that we can do.
Tiffany, that's really good. Okay, so listeners, you're going to push air into your upper lip, then you're going to move it to a cheek maybe, then you're into your lower lip, and then into the other cheek. And Tiffany, you probably don't know this about me, but I'm all about natural. Like, yes. So facial exercises, natural, not any artificial anything. And I think this is sort of like facial fitness in a way.
Yeah, no, you're not wrong. Part of me, as I'm aging, the lines I see, it's like, I'm like, I cannot, and I will not do Botox because it's a neurotoxin.
Absolutely.
And the face muscles. So here's an interesting fact about the fitness of your face. The face muscles are the only muscles in our body that are attached to other muscles. Everywhere in our body, a muscle is connected to a bone or a ligament or not fascia, but cartilage, right? A support object. However, in the face, a muscle is connected to another muscle. That's why someone that has a stroke, they lose the nerve innervation and everything sags, because this nerve that was affected affects this muscle, all connected. And that's how we have facial expressions and why we can do so much with our face. So if we have certain muscles that are overworking, it's tugging on other muscles. Like our face muscles can affect our sight. It could affect tinnitus or tinnitus, however you pronounce it. It can affect our ears. Obviously, our jaw pain, our head, neck, and shoulders, because they're all connected to each other. And so creating harmony, really what I do, I create harmony within those muscles.
Thank you for that. And thank you for bringing up Botox. At the time that your interview is published, an interview with Gretch Elizabeth with Never Talks will have come out. And we talked about botulism toxin A and the serious side effects neurologically, physically, but also emotionally in terms of nonverbal communication. So from what I've learned about you and researched about you, you're really helping people with communication in so many ways. And I think that's just critical for relationships. It's a real missing link that we're forgetting in health in terms of people's ability to communicate clearly with each other.
Yeah, absolutely. And just speaking about the effects of the muscles and the communication, when we prevent that movement, let's say we can't even smile the right way. If we don't smile, even if we're happy, we don't create the same hormones to encourage more happiness. Like just the act of smiling alone when you're sad can make you happier. So if you shut down facial features that are associated with good mood, health, love, then you're going to have a harder time producing the hormones that are going to let you feel those emotions. So communication is a part of that.
Right. That's such a great point. You know, there are studies saying that people just fake smile. It's going to help them, you know, emotionally.
Yep.
Because of the hormones released.
Yep. And to further that point, myofunctional therapy, there are a lot of people doing it now. It's still new. Like doctors just are not referring as an option to improve people's sleep apnea results. However, I did see improve the airway on a sleep study recently. So the awareness is there, but I just don't think they know exactly how to do it. But anyways, yes, myofunctional therapy. But because of my background, not just in oral health and the myofunctional approach that I do, my health coaching has allowed me to take that communication into effect. Mindfulness, gratitude, sleep rituals, the environment, the sleep environment that we have to improve our quality of sleep in the air. It's so when I am seeing my clients, I'm taking a very holistic approach, just like I do in my hygiene with my EMS biofilm, airflow, like speaking from a biological dentist, I have that. I was the first one in Newfoundland. But I take that same preventative approach to our entire life because you're not just a person who snores that has an oral dysfunction, but that, depending on what your age is and what your symptoms are, it's created patterns in your life that have compensated for the health that you otherwise would have had if you had the proper oxygenation to your brain and to your muscles. And so I do take that holistic approach to my myofunctional therapy care.
Well, and the thing about it, Tiffany, when you help, say, a young man, a young girl, get more oxygen, then probably or potentially their attention deficit disorder is going to go away. I mean, this is what we have several myofunctional therapists here that I refer people to, and it's amazing how kids will get off medications. So, I mean, just think about the long-term effects of that. They start doing better in school. They're able to stay awake because they got a good night's sleep. So therefore, they're not doing these, habits to keep themselves awake. The hyperactivity habits maybe because they're just sleepy, and then they're not eating foods that are stimulating them as much, fast junk foods, and I mean it's just on and on and on that you're helping people improve their life. I think there's, like you said, it's primary. Air's number one. So do you have an online business? Is that how it works that you help people? Tell us about that.
Yes. Yeah. Thank you. And we could have a whole topic on children and ADHD and how they present differently than adults with sleep issues. So it's wonderful to hear that because, yes, when you help a child, you're preventing all of these issues in the future. And that is wonderful. So I started during COVID. I learned all of this when I had my 3-month-old baby, breastfeeding while I was learning. And so I'm very comfortable with virtual sessions with people. And in the past, I only did one-on-one. But my time is a limited resource. It's the only resource that we cannot get back. And this is why improving people's health gives them time to live a good quality life, and that's why it's so important to me. But I did recently switch to an online program. I have 3 different options available. It's self-paced, but it also involves assessments with me, group weekly one-on-ones with me, Facebook communication back and forth. So it's not just you see a myofunctional therapist, 2 weeks later, you go back, you get your next set of series of exercises. I'm actually there with you, keeping you accountable, keeping you motivated, and then adding in some lifestyle factors to improve the results of the therapy. And so I have one specifically for relationships because, yes, you want your children to be happy, but you also want the parents to be happy. You want them to be resilient. So they're setting the environment for their children. And then I have a children's version in there as well, where I do my little puffing face is my chipmunk, right? Where I'm, fill your little cheeks with your little acorns and, I'm speaking to children on their level as I progress them through myofunctional therapy. And then I have a condensed version because not everybody has had to compensate in ways where their breathing is affected or their posture is affected. I also include posture in mine because if we don't have our jaws in the proper alignment, if we do all these exercises, we're still not opening that airway and we're affecting the whole chain from head to toe. So yes, I have a large program that is very holistic, but people, maybe they don't have the same symptoms that they don't need a full program. So I have a condensed version for people, or if their finances, I still want them to get the results. And I've given programs out for free. You know what? When you give things out for free, people don't commit. So I wanted to be able to have a program that can still help people, but keep people accountable. It's an investment in their health. And that's really what it is. I have 3 investment options. Invest in your children, invest in your snoring, or invest in your overall health.
Well, I think people need to assess throughout their life. I don't think anybody listening should just say, "Oh, I'm fine." In our dental office, we have a fantastic cone beam X-ray that actually will measure airway. And so I'll ask somebody, "Do you snore?" And most people say, "Oh no, I don't snore." But then you measure their airway, and when the optimal square millimeters is 300, and they'll have, they'll be like 49. And so they're just not getting much oxygen. I don't do that myself, but the other dentist in the office does, Tiffany. But what I've learned from just learning from you, and then learning from working with Dr. Dunnington, is that things can change over the years. I mean, people may say, get their wisdom teeth out, and then that airway can collapse. I mean, everything that God put there is there for a reason, and we start taking things out, and things change. Or say people in their older years lose back teeth, then the airway can collapse. So is this correct? I mean, I really think it needs to be an ongoing self-evaluation. Like you said, it's not something that maybe a physician would refer a patient for, but this podcast is all about awareness for people to know that there are people like you who can help them in simple, inexpensive ways as their body changes from natural aging.
Yeah. That's a great question. And I think I would only get that question from a dentist. In any other interview that I've had, no one has asked about that. But my hygiene practice is in a denture center. So I rent a space in a denture center. And in the past, I always told people to take their dentures out when they go to sleep. But if you think about it, and even with wisdom teeth, I caution if there's infection, if they're in positions where the wisdom teeth are detrimental to your oral health, then you have to do something with it. But just to get them extracted, if they're not causing a problem, as you mentioned, that's bone supporting our facial complex. And so as you remove teeth in the cheeks, fill in the space. Yeah, it's making our airway smaller and smaller and smaller. And so if you have people even with full upper dentures, their cheeks are being held out because of that. You can see when someone takes their teeth out, everything gets sucked right in. Well, they're not going to get enough airway space if they're taking their denture out. So I sometimes, depending on the signs that I see, if someone has poor oral health with the denture and they have to remove it, you have to take every person individually. But for the most part, they have a healthy mouth. I get them to try sleeping without it if they have the other symptoms that are causing problems. I want breath more than anything. And if you can have like teeth in there to keep your airways open, well, that's going to improve.
You brought up two key areas where, as I look back on my 40 years, I have really messed up so much. Number one, telling people to take their dentures out at night. And you're exactly right. Their whole mouth just folds in. Their jaw comes forward. They start having oxygen hunger. So, they're breathing through their mouth. Number two, having people get their wisdom teeth out, including, my own children, just thinking that was a natural progression until, Tiffany, probably literally 5 years ago, when I questioned it, started learning a little bit about airway. And I remember the first person I told, no, I don't think you should get those wisdom teeth out. And I was kind of like, am I going to get, shot? Is this going to be, is something wrong with me? Because we were just so trained as dentists, like, oh, those wisdom teeth come out. I mean, period.
Yeah.
And now we know not only is it airway, Tiffany, but it's also potential, areas of infection in there, cavitations that can form when, that's not cleaned out thoroughly. So thank you for bringing this up. So listeners, question wisdom teeth coming out. They're there for a reason. Even if they're not in, even if they're impacted.
Yeah.
We have now 3D x-rays. We can evaluate those suckers every 3 years and know if indeed there's infection. And there's usually not. I mean, in reality, they're usually fine.
Yeah, exactly. And talking about the wisdom teeth, another reason I'm so passionate about what I do is because I am the person with the dysfunction in that snort. I had not only my wisdom teeth taken out, but I had my premolars taken out for orthodontic work. So over 100 years ago, the grandfather of orthodontics had talked about sleep apnea and the importance of growing our face and how they're connected. But orthodontics ended up training and making the teeth fit in whatever space the bone is. Let's make the teeth look pretty. They never considered taking teeth out and how that makes everything smaller, how it can create underdeveloped sinuses, right? And then you have chronic allergies and asthma because you had your wisdom teeth taken out in order to get braces, or not wisdom teeth, other teeth taken out in order to get braces. And you are not growing your jaw forward. So orthodontics talks about reconstructing your smile to fit on the small foundation. Myofunctional therapy, if you catch it when someone is between 5 and 10 years old, you're going to grow the sinuses in the upper jaw wide. You're going to create a big foundation for the teeth to come in naturally. And then you end up with the proper growth and development of the face. It improves your oxygenation, reduces your risk of like ADHD and digestive issues and all of those underlying things that we talked about in the beginning that were connected. But don't just question wisdom teeth removal. Question why your orthodontist wants to take out teeth in order to make your teeth fit in the little space, as opposed to grow that wider and make the space for all the teeth.
Thank you. I literally got teary. Like I felt my eyes fill with tears when you were talking about that, Tiffany, because this is so big, listeners. I mean, for your children, for your grandchildren, with simple appliances, simple exercises, the jaw can grow. We don't need to shrink it to fit the teeth. No, we can grow the jaw and all the teeth will fit. And it's so much also based on the food that children eat. Talk about that, Tiff.
Yeah. So our diet is very soft food, sucking foods like puree. Puree is a baby, as opposed to introducing whole foods at a young age. You can start 4, 5, 6 months, depending on the child, introducing solid foods, as opposed to just pureed everything. And then the yogurt drinks that we're sipping back and the applesauce packs that we're sipping back. All these soft foods, the goldfish crackers, the noodles, all these processed foods that you almost don't even have to chew. So those will create more of a sucking motion. So as you suck in the face, your face will elongate. Your upper jaw will collapse into a high, narrow palate, again, creating underdeveloped sinuses. It can deviate a septum. It's me. I was a mouth breather. I had these. So like this is the result of myofunctional issues. So I have a very small upper jaw. My lower jaw kind of sticks out more, right? Because the upper jaw is too small and indented for my face. And that's the mouth breathing, right? Pulling down, or the sucking of soft food, pulling in. So that jaw is tiny, narrow. And so rather than having a nice U-shaped arch, you end up with a V shape. So you end up with that pointy smile. And that's, it can start in infancy, really, with what we're doing. If we're not breastfeeding our child, the child who's not breastfeeding, look into tongue ties, find a real lactation consultant that is like an IBCLC trained lactation consultant, because the tongue pushing up and compress or pulling the milk, expelling the milk, is the very first myofunctional therapy for a baby. And if they're sucking through a bottle, they're not learning a proper swallow. And again, they're sucking everything in. You're making things narrow. You're not allowing for optimal growth and development. And then the cavities and everything else, especially. Okay, so parents, if you're shamed going into the dentist because even though you breastfed or whatever reason, you brush your child's teeth, you feed them good, healthy food, they're still getting cavities, are they mouth breathing? We don't talk about that, but the microbiome is affected if we're mouth breathing or snoring. And children should never snore, okay? And we should have our mouth closed. So those are red flags too, like poor oral health despite good, healthy habits.
No, it's huge and it's upstream. I'm working on a book about the oral microbiome, so I've been doing a ton of research. And so you think about correcting the oral microbiome, that changes every part of the body, especially the gut. I know you know this, Tiffany, but for our readers, and one bacteria in the oral microbiome, Fusobacterium nucleatum. My listeners know I love to talk about Fusobacterium. I call it the mother-in-law bacteria because it's in low levels, it's actually beneficial, but as it gets bigger, it causes a lot of, it can be a pain in the gut, but it is considered causal for colorectal cancer. So, colorectal cancer is the number 2 killer of cancer in the cancer category as of yesterday when I read about it. So you think about the importance of what you're doing to help people breathe better balance their oral microbiome. I mean, downstream, this may decrease cancer rates. It's so big.
It is. So again, this is amazing, you understanding the microbiome in the gut. Because, if we're mouth breathing or not swallowing properly, we're swallowing or intaking more oxygen into our stomach. Our stomach is more acidic than battery acid. We need that to digest our food, so it makes it into our intestines in a digestive way that will not create autoimmune conditions. But if our mouth breathing and the poor swallow is changing the pH of our stomach, we end up with more bloating, because we don't have enough stomach acid to break down our food. And so food is fermenting. So you don't necessarily only have acid reflux, because some people don't get it. Some people, there's not enough pressure. There's not enough acid in the stomach to keep our esophageal sphincter closed. Acid will slowly leak out. We notice it in patients who have a lot of acid erosion in their teeth. They're not necessarily having acid reflux, but their teeth are eroding from low release of acid, whether it's burping or not, or just when they're sleeping, because their pH is out of balance in their stomach.
So Tiffany, this, boy, I'm learning from you. Is this, a lot of people, are taking these proton pump inhibitors. So really, airway should be the first thing they consider before taking Prilosec, Nexium, blah, 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 all this. I mean, people are taking them like candy.
Yeah. And that's one of the drugs that are like sleeping pills, that they're only meant for a short period of time. Like people have them for life and they rely on them. But again, it's masking a symptom. You might not have too much stomach acid. You might not have enough. Right. It's very... Like the reflux is because the acid is seeping out, because there's not enough acid to keep the sphincter closed. And so you're getting the symptoms of reflux because the sphincter's opening and allowing acid out, causing some heartburn. So then you just put that baking soda, let's say, or you want to reduce the pH, but you're reducing it so much that, again, you're not digesting your food properly. And you're creating an environment for like H. pylori, for a dysbiosis in the stomach, which can lead to cancers. It's actually H. pylori is one of the main reasons for stomach cancer. You can be healthy your whole life and then end up with stomach cancer, and they don't treat it. You know how hard it is to get an H. pylori test? I got it. I'm telling you, I am all of my symptoms of a myofunctional disorder. And I had to fight with my doctor for the study. I ended up finding out about it from GI Map, which you know about. GI Map showed me H. pylori. I didn't know the symptoms at the time, but again, it was related to my myofunctional disorder. And then all the pieces, again, I got treated for it. I retested with the GI Map, and I no longer have a virulent factor, and I no longer have a dysbiosis of H. pylori.
Oh, you had a virulence factor. I use H. pylori. Yeah, I mean, I use GI Map consistently, as you know, and I love it. And I always address even early before it's at their reference range, because it's a transmissible, transkissable bacteria. So, it really matters. One thing I found, Tiffany, that is good for treating it, especially early, is our broccoli seed sprouts. Broccoli sprouts. So, I mean, there's a lot of ways, but boy, that's super interesting. I really appreciate this information from the standpoint of causal. I've just never thought about airway and stomach acid.
Yeah. Okay. The more you know, the more you
Mhm.
realize you don't know.
Right.
I
Amen.
don't
Amen, sister. I
I don't
totally
know. Yeah.
agree.
I don't know if I'm happier knowing this information because I just can't stop looking into it more and more and more. And it's consuming me because it's so interesting.
Oh, Tiffany, I agree. Our children cannot move home. Not that they would want to, but their rooms are full of research. I bet I have 10,000 research articles here because, somebody will come to me and like this, it's like, oh gosh, so now I've got to research that because there's so much to learn. But it's really just so much fun.
Okay.
I'm 66, you're way, way younger. And so there's just so many people that are like us that are learning and growing and, experiencing life to the fullest because of these wonderful conversations. Okay, so tell us about resources on your website for our listeners.
Yeah. I have it mostly. So my website is just mostly information, letting people look at the symptoms that are related, and they can in a way self-diagnose. Like, wow, all of these, maybe there is something going on with the way that I'm breathing or using my face muscles. I do have a guide that allows people to discover why they're snoring. It has to do with, I ask them questions about their sleep environment, their habits, how their lips are at rest, where their tongue is at rest. And again, a bit of the self-diagnosis to try to determine if an oral dysfunction is the root cause, or if it's maybe because they are drinking too much, or, they have allergies that weren't considered. So it's just a guide. It's a free guide that people can access for a first step. I also offer a personalized sleep audit. So if they don't quite understand or they want to know a little bit more about their oral health or their sleep, not oral health, oral myofunctional health and their sleep, then I have a way for them to fill out a questionnaire, and then I will personally audit it and send them back some information and resources and anything that I find valuable for them. And then I have webinars with information. I do webinars usually about once a month for any new people that end up finding me, and that allows me to connect with them, closer to one-on-one, ask real live questions and create a relationship with them. I have a Facebook group, Sleep Solutions with Tiffany. And so that's where I put a lot of information on different options that are out there and things that I just come up with, sometimes just in the moment. And then I have my programs, the 3 programs I have. The child's one, just a stop snoring strategy. And then I have the Stop Snoring Solutions program, which is the full holistic.
And those are available on your website, correct, Tiffany?
Yeah.
And tell us your website address.
It is mindbodymouth.net.
Mindbodymouth.net. And then what social media platforms do you prefer?
Instagram and Facebook. And Instagram, it's Mind Body Mouth Coach. And Facebook is Mind Body Mouth.
Okay.
Yeah. There's little links on there too, which can direct you right to those, right to any of those options that is most suitable for you, as well as booking a call with me. I have 2 different calls that I have absolutely free. One is just a 15-minute chat. Anyone just wanted to ask me some questions. And one is a half an hour snoring assessment call. And that's where we would actually determine whether or not my program, would be really beneficial for you, because I don't just allow people to get online and just buy my program. I want to screen you because myofunctional therapy is new and it is beneficial and valuable. And I want people to get results. And so I need people that are accountable for their health. And so I really will determine, I'll vet people and say, yes, you would be a candidate. And these are the 2 options that I would recommend for you, versus just sign up online and here you go. Here's a self-done-for-you program. because we all know the accountability is so important for long-term results.
Mm-hmm. Well, I totally believe in myofunctional therapy, Tiffany. I send people who have headaches, tinnitus, even weird toothaches. Like if there's something that you can't see a real reason for, like don't go get a root canal or just don't let them just do something. Go get myofunctional therapy and see if it might be a muscular problem. It often is.
Yeah. And actually, Debbie, can I provide your audience with a tool for those random pains? So I've had clients come in and we're going to get a root canal. They've been waiting for a year with pain. After doing this, they no longer needed it. I had people that had a filling done and then they went back and they got desensitization. They got fluoride varnishes. They back and forth and they were taking Tylenol. And this was someone who was against medication and against fluoride, and they did everything. She did this exercise, her pain went away. So I've experienced it on many occasions, enough that I went to a yoga class and I did face yoga, just a superficial version of myofunctional therapy. But if you have TMJ pain, and actually my program has a mini TMJ program within it, free, because I don't want you to do myofunctional therapy if you have TMJ. I want to balance your jaw muscles and then you can progress to the therapy. So I do help people with the jaw pain too. But yeah, random tooth pain, jaw pain, headaches, can't figure out what's going on. You take a Q-tip. And I don't have a Q-tip here, unfortunately. I have a chopstick. So I use chopsticks in my...
We're going to pretend this chopstick is a toothpick, a Q-tip.
Is a Q-tip, yeah. You do not want to go bigger than a Q-tip. You can use a stir stick from like Starbucks. You can use a Q-tip and you bite down on it in the front 4 teeth. Just gently biting down, okay?
We'll do a pin.
Okay. And again, you would never do it with a pen at home. You get it.
Okay, don't do a pin. Don't do what I did.
This is just for demonstration purposes. This is too big. It's not going to hit the proper nerves that we want. This is neural. You're turning off the 12 cranial nerves. Mm-hmm. You're going to reset to go into parasympathetic nervous system with this.
Ooh, cool. We love parasympathetic rest and digest. We love it.
We do. So when our teeth touch together, automatic stress, right? We think about you clench down. Yeah. Automatically tooth to tooth is going to override every other cranial nerve, and you're only going to activate the trigeminal nerve. So if you bite down gently on a Q-tip, you then put your tongue to the roof of your mouth, close your lips. Okay? And then you're breathing in through the nose, slow and quiet, and you're exhaling with a hum. So long of an exhale as you can with the hum. And you do that 1 to 3 minutes a couple times a day. I have that video. Perhaps if you want, I can give you the link for that video so people can follow along at home with it. You remember all of the steps.
And if you would collaborate with me on Instagram, I'll put that out on my Instagram as a little video, Tiffany. That is incredible, folks. I know if you're listening just audio here, it might be hard to grasp, but you can learn from Tiffany on this. There's no telling what even surgery this could save. I mean, in the world of dentistry, I've been a dentist so long that 40 years ago, temporomandibular joint problems were like woo-woo. Let's just do something. Let's just, we don't know what to do, but let's just do something. And I think that's still how so many things are approached. Like if we do something, that's better than nothing. No, a lot of times doing nothing is better, and waiting for somebody like you who's going to show us something super simple, non-invasive, and probably free. I say vitality doesn't need to be confusing, expensive, and no fun. And this is the perfect example of that. So be watching my Instagram, and then also look at Tiffany's website, because this is huge. This is huge. So many people are having TMJ problems these days. It's on the rise. I guess all the stress in the world.
Well, we always attribute it to stress, and stress is part of it. But if the airway is collapsing in our jaws. If we're mouth breathing, and so many of us are mouth breathing and snoring and the mouth is open, it's pulling the jaw out of the proper socket. It's wearing down the joint, the bone. We're then clenching, and that's putting pressure. So the link with the tinnitus and the pressure from clenching all the time. Because if we go back to that root cause of when you fall asleep, so let's say this is the roof of your mouth and this is your tongue. When we fall asleep, our tongue blocks the airway. Okay. And then all of a sudden the brain says, well, we don't have oxygen. Boom. Sends cortisol out to open your airway because it needs to stay alive. So these are your teeth here. Boom. Grinding teeth. Fall asleep. Grinding teeth. Falling asleep. Grinding teeth. Falling asleep. To the point where sometimes you do this and then the jaw will clench. The brain will tell your jaw to clench down. And then you end up with headaches and jaw pain because these muscles now are overloaded with overuse that is putting all this pressure in the nerves here, creating head and ear problems.
Mm-hmm. Yeah.
And the reason why snoring is so linked with Alzheimer's disease and heart attacks is because of those episodes. Even if you're not diagnosed with sleep apnea, you could have 8-second deprivation of oxygen instead of 9 to be diagnosed so many times. And you do that, you might not come out of a full awake state, but your body awakes. So you're shooting cortisol all night. So all day, you're go with the stresses of life and maintaining a household and work-life balance and everything. And then at nighttime, when you should be repairing, you're just shooting out cortisol. You're never getting into rest and digest. And you end up, again, with that hyperactivity, the brain fog, the just running on cortisol. And then we end up dealing with peri and postmenopausal issues. Like, why do some people get such bad menopausal effects? Because the effect of sleep and estrogen. There's a whole other topic.
You are a wealth of information. And I think we want to revisit this in a few months, Tiffany, because you've stimulated so many questions inside my head. I mean, we could explore the whole area of stomach acid and gut health and hormone production, and I think we want to do that at some point if we can, because there are solutions. There are good solutions that are empowering to people, that habits they can incorporate. So thank you for being here today. And thank you, listeners, for joining us. So we'll put all of your information in the show notes. And this is your starting point, folks. We're going to bring more information to you in 3 or 4 months. So you do your homework now. Start your breathing exercises. I'm going to be doing my puffy lip stuff, and because it just makes sense to me in every way. Tiffany, thank you, and thank you, listeners. I think we're now in like 135 countries, and I don't know how many, 5,500 cities, and that's because you all are sharing. And please subscribe. Please. Just anybody that this can help. That's what Vitality Made Simple is all about. It's about feeling better, living life to the fullest, living out your purpose, and being able to fully love the people in your life. Blessings until next time.
Thanks for joining us on Vitality Made Simple podcast. Be sure to visit drdebbieozment.com for our courses and resources designed to help you feel better, look better, and enjoy better relationships. Please remember to like, subscribe, and share. Thanks for joining us.